Good evening, everyone, and welcome to HLA Live. My name's Johan Malwana, and this is the first episode of what we hope is a new series that we're starting. So we will be going out to a wider audience who are interested in everything to do with the HLA, leadership, and the work that we've been doing at the HLA. So today's first episode is all about digital health. We are talking to some of the leading experts that we've identified in the UK about digital health, and I'm looking forward to a very interesting conversation with some of our incredible speakers and participants. So the first person I want to introduce you to today is Hassan Chaudhury. Hassan is the lead for digital health at Healthcare UK. He is one of the country's kind of leading proponents of what's going on with digital health. He has been at the forefront of the digital health movement in the last probably the last 2 years, promoting the UK to our global audience, to our global partners, and promoting the digital health industry to a huge amount of people. So let me first of all just hand over to Hassan, let Hassan introduce himself and tell us all about his work. So Hassan, introduce yourself, please.
Thank you so much. That was a wonderful introduction. And Johan, I'm really honored to be here at the first episode of HLA Live. My background, I actually started in social work, so being in the homes of service users. So when I later became an analyst in the NHS, I was looking at numbers, but I was thinking these are real people. And it's important that when you're looking at numbers, patient numbers, you're thinking about who the real stories are. And later I set up a company in digital health. It was a real world data analytics company. And I've exited, and I'm currently the digital health lead for Healthcare UK, as you correctly said, at the Department for International Trade. So I promote the best of the UK abroad. I promote the health sector generally. I support the NHS to export, as well as private sector. And I also look for the best innovation in the world and help it to come and land in the UK. So that's me. Thank you.
Great, Hassan. So Hassan, can you tell us about what is going on in digital health in the UK currently?
Well, since I'm on this particular webinar, I think it's important I don't pull any punches. Rather than me just giving a glossy overview, I think we should tell some hard truths. Digital health, as a beginning, is not in a great state anywhere. My honest opinion, there's lots of places that can throw money at it, but digital health has often been a battle between those who want change and those who resist. And we've seen recently, because of COVID-19, there's been a big shift towards adoption of digital health. But the concern from many innovators is how come it's taken so long? So we had a CIO, very innovative, Adrian Byrne from Southampton. And Southampton are one of the global digital exemplars. And he mentioned on a webinar recently that he was thanked by a consultant at his hospital for giving him, for the very best thing he's done for him in digital health, for giving him a laptop. That's the level that we're at. We genuinely, we can tell everyone how great we are, but the truth is there's a lot of work to do. So I don't want to sell you a pipe dream. What I want to do is explain to you what I think the future should be. And there is a battle for that future. And that's the conversation we should be having.
So tell us more about that. What do you think? Where are we going over the next 5 years with digital health in the UK? And obviously in your role, you're working with our global partners everywhere. I mean, so what is it that's happening in the UK? Where do we position ourselves? And how is the rest of the world kind of acting with regards to digital health?
So I wear a government hat, so I've got to be very careful exactly what I say here. But there's a tendency for everyone to look at the big American electronic patient record companies. They look at Epic, they look at Cerner, and they think, okay, that's the heart of the hospital, the brain of the hospital. That's where we begin with digital health. What I've found in my journey is to find that the phrase digital health is so broad as to be absolutely meaningless. Really, we're just saying any technology that can make health or care more efficient, faster, more accurate, reach further. That's the realm of digital. And it's important we broaden that definition rather than stick to the old modalities of this is an electronic patient record, so this is digital health, because then we can start to think very flexibly how we can improve care. And that's the problem. Health and care needs to be improved. And the only way we can do that is with technology. We don't have, and this is a line I've stolen from you, Johan, we don't have enough people to be able to train the people who deliver care. We don't. And education and training is going to be a challenge. So again, we need digital. Lots and lots of things are happening where we need to augment. And when you consider that broader definition, then you can start to move to what I think the trends are, which is that primary care needs to be digital by default. For a long time, we were resistant for patients to have their consults with GPs. And there's a GP that I follow on LinkedIn, Dr. Neil Paul, who is often asking the question that we're all thinking. And he asks, well, now I'm doing consults, sitting wherever I'm sitting. What's the point of me having a practice? What's the point almost of us being contiguously bounded? I could look after patients anywhere. You know, these broader ideas about digital primary care are now in play because patients are now used to having digital consultations, which are, by the way, mainly phone calls rather than video. Another question is, why does outpatients exist? Why isn't it that while you're with your GP, they dial in your consultant perhaps, or registrar, but somebody's able to give that opinion there and then, rather than making a referral, then we wait for another 10 to 12 weeks, you turn up and then someone looks at your notes and thinks, well, actually, we didn't need to see you. We could have just seen you in 6 months' time. And these are the kind of things that we can start to change the way that we consider care being delivered. That's what digital allows us to do.
Okay. And do you think that we can make, I mean, how close are we to that kind of dream scenario? Like, because you always hear, I mean, a good example is virtual reality, right? We've been hearing about the virtual reality being on the horizon for as long as, since I was a boy, and that's a long time ago, let's face it. But we have been hearing about it. You know, we had the films in the 80s about VR and stuff, but where are we with digital health? Because there's so many, and I guess it's in the area of digital therapeutics, or you know, what should we be doing about that kind of, where are we in that horizon, basically?
I'll be honest with you, I think there's some great companies that have got some wonderful technology, but the ones that do well, especially do well internationally, is that they own a problem which is universal. So we're going to hear from Synapsis, for example, on referrals and pathways and getting that right. That's a universal challenge. And if you can get that right in the UK, then people are going to trust it, because there's a respect for the way that we've done things in the UK, especially our medical education. And there are people that want to know how we've solved it. So our challenge isn't about the blockchain and the augmented reality and the quantum, even though it's nice to have all of that stuff. And there are companies that we will promote at the Department for International Trade who've got what you might call the sexy stuff. But really it's about the foundations of how you will look after a patient journey from the beginning to the end of the pathway and circulate them around. And I think that's where digital health is becoming more and more mature in the UK. How can we be interoperable? So you can have a patient-controlled record, a lifelong record. That's something that I want to see, because rather than all the silos of care being a barrier to the data, the patient, who is the only common factor with all of that, carries the data with them. Those are the things that we want to see. And that's where I think our focus has to be.
Okay. And what should clinicians, so obviously most of our audience tends to be in the clinical space, and I know you're a clinician by background as well. What should clinicians interested in digital health think about? I mean, across health systems, like how do they approach it? How do they get involved? How do they really kind of engage with the revolution that is coming?
So I'm going to make fun of clinicians for a second, if that's okay, right? And I know you can see this one coming, Johan. Clinicians are often accused of having a laser focus, being too narrowly focused on something. And that can be good and bad. So when you run a company, you need to have that laser focus. You need to have the critical path and make sure it gets done. But the problem is you need a generalist mentality as well. Leaders need to be able to do that laser focus, that critical path, follow it, be determined, be good at saying no, but also be able to look after the sales and the marketing and the fundraising, and perhaps the most important, hiring. Because if you hire badly, you're screwed. And that's the experience of almost every innovator, every entrepreneur in every industry. Hiring is the big deal. So if you're so focused on something that you don't delegate, or if you do, you delegate to the wrong person, you're going to spend months trying to recover all of that. So my advice to clinicians, if they're thinking about digital health, is consider the team. Consider who you've got with you, because you're not going to be able to do it by yourself. And when you do have that, consider specialists and generalists. Consider those who can do a few different things, and those who are very, very good at one thing, and bring them together. That's how I actually think that clinicians often fail when they're clinical entrepreneurs. Very, very good at their one thing, but they haven't considered the rest.
That's really interesting, actually, because Hassan, that's coming from the perspective of those kind of clinical entrepreneur, as you say, the clinical CEO or whatever. What about, I mean, I guess the other question for the vast majority of the audience is that they really passionately think that, you know, digital is the way forward. They want to get involved with digital. They don't necessarily want to spend all their time running a company. They want to be clinical, but they want to also be involved with digital. So for that group of people, the people that are really passionate about healthcare, but also they want to be at, you know, in the digital health space, they want to be engaging in that, what should they do, and how would you what would you suggest to them from your experiences, both being an entrepreneur but now being someone who's taking much more of a strategic role?
So I guess I'm going to ask whoever it is that wants to be an entrepreneur a couple of questions. And this is a common set that I ask. I ask them, how honest have they been with themselves? And have they had a friends and family audit where 5 people around them have just told them honestly, no, you're rubbish at this. Genuinely, you're rubbish. You're the guy that's always late whenever we're going anywhere. Or you're the woman that always forgets it in the diary, right? Whatever that is, whatever your weak spot is, that's okay. No one's asking you to become 10 out of 10 on everything. That's not realistic. But find somebody you trust to fill that gap. And then you can focus on what you're good at. Because as a clinician, there's something that you can see. Maybe in your clinical experience, you can see something that's not working. And you're passionate about solving that problem. And that's great. That's amazing. And that awareness and the context that you have, other people who are not clinical will not have seen it. There's no way they will have seen it. You just got to respect. And this is important. I think the phrase is respect. Respect your own gaps. Don't think, oh, it's fine, I'll get over it. You've got to work very, very hard at making sure those gaps are filled. So I'm honestly of the belief that you fill those gaps with other people, and then you make what you're good at even better. And that's how the whole thing grows. There's some areas you do need to be good at regardless. So if you're not good at managing people and managing conflict, then you're going to have to fix that. But if you're not good at finance and fundraising, there's a minimum level that you need, and then you need someone very good on your team. Sure. And that's how I think it should work.
And the clinicians that want to join a kind of an entrepreneurial journey, maybe it's not led by a clinical entrepreneur, but they want to join a digital health kind of journey. How do they fit in with that? Or if you're working in a hospital and you care about digital health, like what should you be doing? What, in your view, how have you seen that kind of part of the journey work?
So I've seen it happen in 2 ways. The first is where you've got clinicians banding together because they can see the problem. Most of the time they continue doing clinical work while they do their digital health startup. And that works well until you know you're ready to quit the day job, or at least just move down to a day a week so that you can focus. There's another way, which is where you get a blend of people who are clinical and non-clinical. Let's call them business for now. And sometimes the business people override you on areas that are your clinical expertise. So you've got to set the stall out early. This is not your zone, your domain. This is mine, right? On this area, no way are we ever going to compromise. Set your stall out early, because I've seen conflict on those. Because sometimes setting your stall out means there's not going to be a conflict, even if it costs extra money. Or if it means you need to get regulatory approval because you insist it has to go that way. And I've seen that kind of conflict in mixed teams. But we get clinicians together doing it, I think they all respect their boundaries. It's the mixed teams that need some agenda setting and reinforcing of boundaries.
So like I've seen you personally help and advise a lot of people, a lot of individuals, as well as a lot of companies. If someone's looking for advice and they want to come to you, when in their journey, their digital health journey, should they be coming and talking to you in your role? And also, I guess that leads on to another question, which is how should they identify people to go to and kind of test their ideas, get good advice from? How, in your experience, because again, you've sat on both sides of this problem, right? So how do people find those kind of people to help them on that journey?
So that's a great question, and I think it's difficult for me to say what I'm going to say, but I'm one of the last people that a digital health company would go to if you look at the amount of work that's required. Because I'm going to be interested in you, if you're a British company, when you're ready to scale, ready to go international, because you've done well already. You've already got some good sites in the NHS, you're already commercially strong, you've got cash flow. Now, if you say, well, I want to aim for Europe, I want to aim for Australia, New Zealand, and the interest came, you could handle it. That's the time that you'd come to me, because then I'm going to open the door to 109 British embassies. And I'm going to train all of those embassy staff who've got commercial teams in them, who are competing with the Americans, competing with the Israelis, the Dutch, the Swiss. And I'm going to say, well, this is a better solution. You know, Infinity Health is a better solution for this than those guys. That's where you come to me. So there's a series of steps that you need first. The first thing is you've got to make sure that you're not dreaming, because there's this problem that many companies have, and it's not just in healthcare, where they say, I know this is a problem, and they don't ask anybody. They get their product ready, they do all the marketing, they make their little website, they all even quit their day jobs, right? Then they turn up and they try and sell it, and like, no, it's fine, I don't need that. And they fail the most basic test, and they either die as a company or pivot. And I say that to you because it is such a constant that it's now, even though people have remortgaged their homes to do this and quit their jobs, even though there's tragedy there, people still keep doing it. So how do you test your problem? So there's a book actually on this called The Mum Test. And the mum test is a very simple theory, which is if you ask your mum, and this is the theory of the book, if you ask your mum, would she buy your new app? Your mum will hear the need in your voice and say yes. So you'll think, great, my mum says she'll buy the app, I've validated my problem market fit, I'm ready to go. In order for you not to fail that, you have to ask questions that don't have an obvious answer. And if your mum at the end of that says, actually, yeah, I would buy that. In fact, I've bought things like that already, and I've spent this much money, and I'm about to buy a similar thing already, that's validation. And that's what you have to do. You have to ask uncomfortable questions of people to make sure that you've validated that the problem exists. It's not enough for you to think it. You have to make sure the buyers exist. And if you don't have buyers, you've built something and you haven't got an idea who your customer is, then you're going to have to either die as a company or pivot.
So, I mean, I think that leads us onto the kind of the nub of the problem, which is, can you give us an example of a success story that other clinicians can emulate, where in your experience they got it right, but also what we all can learn from their story?
So there's a theory about falling in love with the problem. If you really know your problem, really know your customer, then you slowly get to that point. That's great. But there's also one that's more, I think the phrase might be opportunistic. You see an opportunity, you go for it. So those are the two, the slow burn, where you take your time, and the one where you see a gap and you go for it. So this example is Card Medic. And Card Medic is a British company that is now had its product used in over 100 countries, because it's a digital flashcard used by clinicians when they're wearing PPE and patients can't understand them. And it was inspired by reading an article about a patient who survived a long inpatient stay, saying that they felt anxious and concerned and worried because they couldn't really tell who was talking to them, why they were talking to them, what the tone of voice was, all the things that you learn when you're trying to do these things, when you're trying to speak to patients. It's all hard to see because of the mask and everything. So these digital flashcards were made by Dr. Rachel Grimaldi, who's an NHS anaesthetist. And these flashcards are on your phone or on your iPad. And with that, you can communicate with the patient in a way that gives them some comfort and some reassurance. It's now been used by over 30,000 patients in over 100 countries. From COVID-19's, if you like, the beginning of the panic, from March to now, you would say that that was a slow burn, right? No, it's not. It's opportunistic. Right? She went for it. And now she's in the position where she's been given the Points of Light Award by Boris Johnson. You know what she did? She went to the DIT and she got an international trade advisor. She got Estelle. And Estelle said, okay, great. This sounds like a great idea. Phoned up some people who are commercial officers in all the embassies. And they said, yeah, this sounds like a good idea. And they handed it over to buyers. And each of those buyers said, yeah, I'd like that. Now, at the moment, it's free. So Rachel's now in the situation where, how does she move that product forward? But being used in 100 countries, having all that PR means she's got a great foundation to move forward. So she found a real need and she made sure that she got it in the hands of the right people. And at that point, the DIT just spread it everywhere. That's the kind of thing that I think we should look for opportunities, as well as having that long, slow burn. You'll got it in your back pocket, but sometimes an opportunity comes up.
That's a great story. I mean, that shows just how fast sometimes these digital innovations can spread, as you say, so quickly across the world, and make a real difference in patients' lives. I mean, that has had a material impact. Okay, so Hassan, we're really fortunate because we're going to be joined by some of these digital innovators, entrepreneurs that have done some incredible things over the last several years in different parts of the health economy. They've innovated, and I know you know a lot of them both personally and also professionally. So I'm going to let them each introduce themselves, and then we're going to just hear a bit about their journeys in terms of innovation and the digital health space, and then we've got a chance to have a general kind of conversation at the end, just to kind of address some of the varied areas of interest that we all have, and how we think as a community we think this is going to go forward. So the first person I'm going to introduce is Lucy, and Lucy is from Straight Teeth Direct and digital dentistry. So Lucy, why don't you take it away? Tell us about what you're doing, and tell us about the innovations you're making in the digital dentistry space.
Great, thank you. Hi, everyone. So I'm the co-founder and managing director at Uplift. It's a group where we have two platforms, two teledentistry platforms. The first one is Straight Direct, and the second one is Instant Dentist. So we've been working on this since the end of 2015, and we've been on the market since 2017 for Straight Direct, learning lots from that. And we launched Instant Dentist at the end of last year. So, and we've seen, as Hassan was discussing, obviously some resistance, and then with the COVID-19, lots of people adopting from the dentist side of things, and patients as well. So in terms of like the innovation landscape in dentistry, historically, you would see that innovation was much more focused on creating new ways for precision dentistry and machines and expensive material for dentists themselves. But it wasn't focused like in medicine to open up access to care and to also make the cost of the treatment more affordable. So it's a little bit different to medicine, especially because with dentistry, it's different, since the dentist will get paid if he performs some procedures. So it's a slightly different approach and relationship also with the patients. And my experience is mainly with, entirely in fact, with private care. So obviously it's a little bit different also with the approach with the NHS. If you look at the landscape, you can think of, I've made a couple of notes, you can think of 5 players in dentistry and in digital landscape. So the first ones obviously are dentists. They're very important and essential. We have seen early adopters, and often those that have been like specialized, like orthodontists, those that have been very interested and patient focused and interested in being at the forefront of their industry. Also, there has been resistance from, I would say, more the majority of dentists who I think are a bit more scared about innovation and changes, and sometimes it's not understanding fully what the tools will be able to bring. So there's a bit of I think a larger education piece that needs to happen here to help them understand. So we've done that during the COVID-19. We've had a lot of practice. We're not able to obviously see their patients, and they are still struggling to see their patients for those maybe non-necessary chats or conversations or checkups. So with teledentistry, they're able to really focus in reducing chair times for checkups and review appointments and things like that, and really concentrate their chair time in more comprehensive treatments. Then the second player is obviously the patient or the consumer, because we always have a direct-to-consumer model. With Straight Direct and Instant Dentist, we connect you directly to a dentist, and you can do the treatment or the consultation at home. So in fact, there is a bit of a different model here. Again, you have early adopters and people that are like, oh my God, more convenient, more affordable, sign me up immediately. Then you have also people who are skeptical. So that's natural, and that's why you require more education. Also with yeah, I'll go back to that after. Then you have the pharmacists, also a very important player in the landscape. We've seen an interest from them to offer digital services, so with GPs, but also dentists. And they want to offer the right products to their customers. I think they call them customers and not patients. And that's important because you will have lots of people go to the pharmacy, they have gum issues or they have a toothache and they need the product, but they don't necessarily know what to buy. So by having those digital services implemented within their pharmacy, that can also help them. Then you have also doctors, medical doctors that are also interested in connecting their patients to dentists and dental professionals, because you have in the UK, from some research, 7,500 people who go to their GP every week instead of the dentist for dental issues, because they find dentistry a little bit inaccessible. They also have that fear of the dentist, so they feel maybe more comfortable with their GPs. So GPs are very much interested in sending patients directly to our platform so that they can get the actual care and attention that they need. You then have the insurance companies. So obviously for them, they can benefit by lowering the cost of the claims through digital assessments and through a preventative and continuous care model. Because with dentistry, it's a very much, I am in pain, I go to the dentist, or I go for my checkup, and nothing in between. Dentistry is, there is nothing at the moment between brushing your teeth or getting a tooth out. So that's what we want to really solve in terms of what we're talking about, real problems in the market. So looking at bringing a more continuous care model with a preventive approach, so that people don't go to the dentist and don't engage with the dentist only when they have a problem, but actually better understand their needs so that they can prevent future problems. And the last player, I would say, are FMCGs. And for them, it's finding new ways to communicate in a relevant way with end users, capture data, which is also big for them, and I guess staying relevant in the landscape, as well as probably getting that recommendation from professionals, which they normally get through samples from dental clinics. So probably getting this through a digital platform would be an interesting thing for them.
Okay, so and it sounds like you've got, I mean, obviously there's a lot of, it's a very complex environment that you're working in, and you've come from a kind of from the industry, right? So I know that both you and your co-founder obviously have been working in the dental industry for a long time. And how was that step, like moving into the digital space from the clinical space? What have you learned in that part of the journey? Because I guess that's a lot of what a lot of our kind of the people out there, a lot of clinicians really want to understand, is that transition from being very much a clinician to being a digital exemplar or a digital entrepreneur or a digital innovator, whether that's within the system or within, or be, you know, or having to start a company in order to innovate.
Sure. So what we did was already we were very much digitally focused in terms of the tools we're using in the clinic. And then we really started the foundation of everything was the problem. And again, as Hassan said, I think that's really essential to start from a real problem, understanding that the problem was people want to get straight teeth, but it's too expensive. They don't have time to come for appointments during the day, and or they live too far, it's inconvenient. So that was really the foundation of starting Straight Teeth Direct, and finding a way to solve this problem by finding a solution that people will pay for, and that will be better, faster, cheaper, or in this case, trying to aim for the 3. So we started really from a very basic MVP. So we didn't go down the route of building the entire product and app for several years and then not really knowing what the market would say. So within a few months, because with my co-founder, with also my husband, we are like quite quick. We have ideas, let's do this, let's do that. So we said, let's launch Straight Teeth Direct. And within 3 months, we thought we would be on the market. So that was a bit crazy. But actually we did a pre-launch within a few months, just to kind of, with a simple quiz capture, just to kind of gather some data on interest from people and so on. And within 2 weeks, we had 500 submissions. It was much bigger than we thought. Initially, we were aiming for the UK for the market. And then we started seeing also that we had people from everywhere, and that it was actually, yes, a universal problem. So we launched quite rapidly. It took us another year to really get everything up to speed in terms of logistics, production, a lot of different aspects. And
because your solution is actually quite complicated, isn't it? Because you've got, like, I mean, I know from talking to you and Alok, it's like, you know, you've got 3D printers, you've got like logistics distributing all over the world, you've got some really interesting and complex soft and hardware kind of technology going on.
And we do everything in-house because it's very important for us to really cut the cost but not cut corners. So to make sure that everything is clinically approved, that everything is to the best quality possible. So we're making our life a little bit harder. And in our space, you actually have a competition that has been like coming up in the last couple of years. And it's competition that really that is DIY. So it's more consumer focused companies, purely lifestyle companies that have no clinical background, and they just send you everything in the post in one go. With us, we really have like monthly reviews with the dentist, everything is checked by dentist, you have a preclinical approval and so on. So it's difficult, it's adding another layer. I would say the education and the questions we get from the public have changed over the years, and you've seen that the market has really matured. So at the beginning it was teeth straightening at home. How, what, even invisible braces, what is that? And now the question is, why should I choose you and not the competitor? So people are much more aware of it. So it's interesting to also see that we've had to really engage and adapt our communication due to the change in the market as well.
Okay, and so I think that leads me nicely onto our next innovator, who's Anas. So Anas is also a clinician and made that transition from and specifically in the software space. So Anas, tell us a bit of background about who you are, what you do, and more importantly, like that transition. How did you make it? How was the challenge? And specifically, I guess from your perspective, it's like, how did you identify that is the solution I want to dedicate like the next, I'm sorry to say, like 20 years maybe of your life to? Or I don't want to break that to you, so go on, Anas.
Thank you very much, Johan, and pleasure to be joining you today with everyone else on today's event. I actually made that transition twice. So medicine, I did medicine as a graduate entry doctor. So I did medicine as a second career, and now entrepreneurship is my third act. And we'll see if it's my last. But my first act was I trained back in Toronto in Canada as a biomedical communication specialist, kind of fancy term for saying I built product for healthcare. And while I was doing that, working for myself and working for a few agencies, I interacted a lot with doctors, with patients, with nurses, with healthcare providers, and fell in love with the idea of doing medicine. I love the science. I already had a science background, but really wanted a clinical interaction, and wanted to be able to create my own content when I'm building products. So I made that decision and moved to London, studied at Imperial College and graduated, worked as a doctor for a few years. And that itch to go back to digital kind of came back again. But I struggled to find the balance of how could I continue to pursue my passion as a doctor and my calling as a doctor, whilst also fulfilling that other side of my identity, which is a digital product creator. And to me, the biggest problem I had with our modern healthcare economy is the rigidity it had with how doctors and nurses and healthcare professionals were employed, and how they were engaged by the system. There was very little flexibility, and often they were faced with very difficult decisions, either to give up every other aspect of their identity that is not clinical, or give up their calling to be clinicians. And like many people on today's on the panel here, who are clinicians by background, we are clinicians, but we're also parents, we are artists, we are musicians, we are world travelers, we are humanitarians, we are entrepreneurs, we are creators of content, and we want to be all of that. We want to continue to nurture all of our interests whilst pursuing a career in healthcare. So I had the lived experience myself and the frustrations like many others. I was also lucky to have joined Chelsea and Westminster Hospital as an innovation fellow. Whilst my frustrations were brewing in the background, I thought there must be a better way to be a flexible worker in the NHS, to be able to pursue my passions whilst still being a doctor. I got to explore that problem from the employer's point of view, because I joined an employer that had a problem, and their problem was we have a big gaps in our rotas. We have a lack of supply of clinicians to help plug in these gaps, and we are heavily reliant on locum agencies. So I kind of connected the dots there and realized that the problem out there is, how can you solve the employer's problem, the hospital or the GP surgery that is trying to have access to a pool of flexible workforce that are reliable, compliant, and can be directly engaged with without that middleman, which is quite expensive, and manage that process efficiently whilst trying to solve the problem for the clinician who's looking more for more flexible working opportunities. And I think that's where I managed to, together with my co-founder, build Patchwork.Health. So kind of a side note here, really with my advice and recommendation to any entrepreneur, budding entrepreneur, is to try and identify an innovation partner in your journey. For me, Chelsea and Westminster Hospital was my innovation partner. They embraced the idea from day one. They were happy to take that risk to be the first early validation site, to help co-design and co-produce some elements of the product to ensure that we do have product market fit, and then to help us at our scaling journey since then. Since then, we've grown to work with over 15 NHS trusts and many other healthcare employers, as well as over 12,000 clinicians. And kind of fundamentally what we end up building is a digital platform that connects healthcare employers to a pool of flexible workers who are able to work in their own terms, be able to choose their own shifts and their own hours, whilst fulfilling and filling that gap in supply for the employer. And that's kind of the beginning what we're trying to do, because for us, flexibility goes beyond temporary staff, beyond ad hoc shifts, beyond the need to address the agency spend issue. It's about creating a resilient workforce that remains engaged with the healthcare system and the wider healthcare economy, whilst pursuing their interest in other aspects of their life. To go back to Hassan's point earlier, many clinicians who want to embark on that journey of entrepreneurship and being or even exploring a career in digital health will find that a struggle. So for us, how can we move the concept of flexible working from temporary staffing into substantive employment, as well as into flexible training for clinicians? And I will never use the word junior doctor because I think I've got issues with that term, but clinicians and doctors and nurses who've graduated from their medical school, nursing school, but continue to professionally develop up until a certain level of becoming consultants or otherwise senior nurses. How do they continue to progress in their careers as trainees, as specialist trainees, whilst maintaining flexibility and not having to leave training altogether to pursue that in the world of temporary staffing?
Cool. I think, and Anas, that leads me nicely onto our next digital health kind of expert and entrepreneur, which is Elliot. And I think we're going to come back at the end, and we can. It'd be really nice to explore actually this concept of flexibility across many of the different solutions that we're actually talking about, and how the rigidity of healthcare is somewhat being adapted to the modern world. But that leads me nicely on to Elliot Engers from Infinity Health, who is a good friend of mine and basically has been doing some incredible things in changing the way that hospitals actually become more efficient. So Elliot, tell us about what you're doing at Infinity.
Yeah, so thanks. Yeah, and so my name's Elliot, co-founder of Infinity Health, and we build task management tools for healthcare. So historically, or I suppose currently, as many of you probably already know, that last mile of healthcare is still very much reliant on face-to-face meetings for handover, verbal handover, which is not documented, or if you are documenting it, it's very often handwritten notes on pieces of paper. And so that piece of paper then sits in your back pocket, and that means that you end up with a huge over-reliance on pages and emails and phone calls and instant messaging in order to coordinate care. And like Hassan was saying, there are some really sexy things happening in health tech with AI and machine learning and lasers on drones. But getting the basics done is where we sit. So we're looking at sort of like coordinating care in ways that have never been done before, because we can now digitize that handover sheet that sits in the back pocket of every clinician and share it instantly. And so just by sharing information in real time, you can completely transform care coordination and as a result, efficiency and safety in healthcare, which right now is a really important thing, because staff are facing down the biggest backlog they've ever seen with the most limited resource and support they've ever had. So it's tools like data analytics and teledentistry and enabling flexible working and task management, and you're going to hear from publishing clinical best practice and smarter referrals. I think it's those sorts of things that are going to be meaningful right now for building capacity. That's what we do.
And Elliot, in terms of your journey, because you've obviously I mean everyone here today has had a very interesting journey into healthcare, but I think your one in particular is a very non-traditional route into becoming a digital health entrepreneur. But you bring a lot of lessons from that previous life into this. So tell us a bit more about how that transition and that expertise you brought into Infinity.
Yeah, so I don't have a clinical background, but I surround myself with clinical opinion and expertise. My background is, so I started out life in the music industry and had the privilege of working with some really cool musicians and promoting the best of British acts. And that was a dream for a while until I had my entire industry disrupted by technology. You know, Apple came to see us and unveiled iTunes and sort of completely disrupted that relationship between sort of like the listener of the music and the buyer and own that relationship. So I've seen what technology can do. I'm a huge music fan, so I think what's happened is great in many ways. We now have a meritocracy, but I think we're going to see sort of as seismic a shift over the next 5 years in healthcare, and perhaps it's been kickstarted by the response to coronavirus. But what I think we're really seeing is a new generation of digital tools that are directly supporting frontline staff. And I think that's what unites a lot of us, because we're laser-like focused on one of those problems. And we're really focused on helping staff get things done more efficiently. So like some of the, I thought I'd share an example with you of like what we're actually seeing right now, and sort of like practical things that are going on in healthcare and how they're being affected by digital. And one of the things we're seeing is that we build capacity by saving time, right? So we optimize like inefficient admin processes. So constantly calling colleagues to check the status of something is an inefficient way to do things. But we also save time by providing like secure and remote access to information that you would need to get things done, which means that we can cut down on travel time, either in a hospital, hospitals are quite large places, or over wider areas when we're caring for patients in the community. So with Infinity, the staff can now access information remotely, which means that they don't have to go into the office first, which means that they can get to their patient straight away, which means that they can spend more time with their patients. And at the end of the day, they don't need to go back to head office to hand over that information. They can do it in real time throughout the day and share that information. So some staff are reporting that their capacity to see patients has gone up by 60%. Just imagine what NHS staff could do rather than battling with the outdated, inefficient admin processes that are really frustrating. You know, how would safety improve? How would job satisfaction improve if you could just give back time to those clinicians? And that's sort of, I kind of come from a world where we were giving things to people that they wanted. So giving them music that they wanted to listen to. And I'm now in a world where everything's essential. And just by doing the basics right, just by sharing the right information with the right people at the right time, you can cut out a huge amount of frustration and improve things for everybody. So that's what I think we're seeing, a glimmer of a future for digital health.
And to be honest, I mean, from my experience with you and Infinity, I know very much that what I've seen is that you do surround yourself with clinicians, and you and not only that, which I find I think is such a great way of approaching. I think you've been to more handovers than I have, because you seem to spend all your time in handovers, just immersing yourself in that handover process. And I thought that's a really interesting way of approaching, you know, thinking through, because often as a clinician, you kind of assume you know what it is that is happening in a clinical environment. But I've watched with you specifically, like how much you just immersed yourself in that very specific problem and looked at things and seen things that I just don't think most clinicians would ever even spot. So do you want to explain more about your innovation part?
So I think, so I do think an outside opinion is useful, right? Because what I've seen is that clinicians put up with a huge amount of inefficiency and just kind of get on with it. Right? So I've been sat in front of clinicians that are taking sort of like 20-30 seconds to log onto a computer, and it's normal and that's acceptable. It's not acceptable in 2020, in my opinion. And maybe it's an outsider's view that things could be a lot better. I do think that there's a huge shift of opinion and expectation as younger doctors come through with expectations about how things should work. But I think you have to, it's not just me, by the way, the whole team immerses itself in the problem. All of us do, from the technical, commercial, comms, clinical, we're all spending as much time with end users as possible, because I think this is a very real problem. Like, I think that the risks are very real. Like, we know that handover accounts for 60% of all hospital adverse events. I mean, that is a staggering figure. So this is a problem that we've known about for a long time. Lots of very smart and capable and well-resourced companies and organizations have tried to solve this problem. So we have If we're going to do this, we have to listen to the people that experience that problem every day, and we have to go, like, take them on the same journey that we're going on and explaining our rationale and being very adaptive. So what Lucy was saying about getting to market soon, validating that what you've got is a real, like, you're addressing a real problem and that you are solving the problem with them is key. And I think that's what this generation of digital health companies is capable of doing, is solving real problems.
I think that nicely leads me on to Alex and Cliniby, because again, complex problems are the ones that we all want to see solved in healthcare. And Alex, I mean, you're working in probably one of the most complex kind of bits of the hospital, complex areas of the healthcare system as your predominant kind of area of expertise. So Alex, tell us more about Cliniby and what you're doing.
Yeah, so Cliniby really, it takes the treasure trove of clinical content that is currently locked up in bureaucracy, horrendous admin, and really time-consuming processes, and basically just tries to extract that and share that across hospitals and across clinical networks. Because an example is most systems that are inside hospitals are generated for that particular hospital, but most clinicians operate across multiple different hospitals. They'll operate across a clinical network. And so we were lucky enough at Cliniby to ensure that we got to work with the ICU guys at St Thomas's. So we were extremely lucky where they gave us access to the entire ICU team. That was about 1.5 years ago. We then rolled out across 8 different hospitals, all ICU led, and then COVID hit, which is probably the biggest test of our product ever in a 2 or 3 week period. And the actual vision for the product was validated because we were able to share content across the whole of South London, which is about 1/5 of the ICU capacity in the UK, and basically validate the product across Italy, across Rwanda. Now it's in Chennai. And so basically trying to support all of these ICU departments as we went through COVID. But the journey is much more complex than that from an entrepreneurial perspective. We were slightly naive in that I was working with my co-founder, who's an ICU consultant, and we had a good product. We knew it saved about 50% of the time that was spent in hospitals producing all of this guidance, and all of the staff really, really liked it. But I'm afraid a good product and buying from clinicians is just not good enough, especially when you're selling to a really big organization, these big NHS Foundation trusts. So whilst the healthcare sector is really ripe for technological-led improvement, the pathway ain't clear, and it's really, really complex, difficult situation that you've got to navigate. And I guess one of the things I wanted to talk about today really is just how you work your pathway through that enterprise, that large enterprise, is really going to be critical for you to be able to get your innovation in there. And I guess we have always taken 2 steps forward, 1 step back. It's never, ever just been plain sailing. Always remember that it's never going to be plain sailing. We also had difficult kind of situations when we were trying to introduce the product into the enterprise. So a large organization of, let's say St Thomas's 16,000 staff, there'll be, let's say, 75 different guidelines leads. So for example, when we're selling the product, we'll have to sell that to 75 different people. And if you get 74 of them and one of them's upset because you haven't involved them, that's your 5 steps back right there. So that's been the big sort of learning point from my perspective, is when you're selling into these big enterprises, it's never going to be plain sailing. You're always going to be taking a 1 step back. And we've kind of got some golden rules now that we follow. So we always never assume you've met all the stakeholders. You will never have met all the stakeholders ever. So never assume that you've got everyone covered, because you just never do. Even when the product's rolled out into the organization, like Cliniby has been. There'll always be more, and they may well be offended, even if they like your product. So we kind of have learned that even though someone likes the product, they might still be offended that you haven't involved them early enough. So it's really important that engagement happens early, and I've ended up going into meetings and just sort of starting with an apology, just to break the ice a little bit. I haven't met you before. You're obviously guidelines lead, but I apologize for not involving you earlier. The other thing is, So for example, CliniB touches all the clinicians, all the governance teams, all of the, it touches IT, it basically touches pretty much anyone within the organization. And how you implement that is incredibly difficult. But one of the things that I think is the next 5 years, integration is going to be a really important component. So if you have a product, for example, our product is rolled out into the pediatric formulary. So the pediatric, we have like 500 monographs for adrenaline, for heparin, for everything in the system. How do you integrate that? Because there'll be a NICU team that want to integrate it into their system. The PICU team want to integrate it into their system. So basically design for innovation, integration and with internal systems, because any innovation that you introduce is going to be a spoke system. It's never going to be the be all and end all system unless it's the EMR. And the other thing that's helped us a lot is we've got some really loyal and strong internal bonds. So in each of the hospitals we're in, there are people that have been through all the bad times, all the good times as we've gone through that enterprise sale. And the other thing that I've learned, which I realized before, is even the internal people don't know the right pathway to help you get your innovation in there. And that's something that people may not admit. And in fact, there are several organizations that we work with where people, they're too proud to admit that they don't actually know the pathway. So the birth of CliniB was actually partly funded by an NHS trust. And we were introducing that product into the trust, and even they didn't know the right pathway, the right committees to go and get approval from, the commercial committees. And so you may well have to design a pathway for them and help them. There may be so many other things you have to do that you haven't even thought that you'd have to do. If you've got a great product and clinical buy and you think, well, that's it. No, most of my time is spent helping with the pathway, helping, making sure they got the right security checks, all of those kind of things to be able to get the product into the system. And I guess the last thing I just wanted to get across is one thing that we found very hard is there'll be an existing system in some way, shape or form that they're muddling through with. So for example, within CliniB, they were using an intranet-based system, but there are people in ambulances that need access to this data. There are people in other hospitals that need access to this data. So the competitor for us it was an intranet-based system, but you have to run alongside that for a while before they're willing to take your product. So devise a pilot, devise a process where you can objectively prove that you have outdone whatever they are currently using, and it's so good that they want to replace whatever they've got with whatever you've got. But you have to be able to run alongside, because they're still treating patients, they're still caring for people, and you've got to be as low touch as you possibly can whilst building that objective data.
I think Alex, it's really interesting, because I remember when we first met, I think we bonded over crying over just how hard it was to convince anyone to take up an idea, and I think it's not just and when you described that to me, I remember it was a very much a kind of I was not only feeling your pain, but you were describing mine, if that makes any sense, which was the ultimate. So what was interesting was it wasn't so much even about the commercialization of the problem you were trying to do. It was just that simple thing you described, where the system doesn't even know how to implement a solution, right? Whatever the problem. So take the commercial part out of it, what was really interesting about the conversation we had was that you described something I was seeing, which was that the system itself just did not know how to absorb like that kind of digitization, the efficiency that we've heard Elliot and Anas and others talk about. It was such a difficult path to navigate. And what was absolutely fascinating was exactly, I think we've all felt this, we've all seen this, is that the system itself, as you say, is sometimes just too proud to admit it doesn't know what to do, right? And I found that, I found when you told me that, when you kind of gave me that insight, I was like, my God, that is so true. Because there are young clinicians out there who are basically thinking about how to implement ideas, maybe not even on a commercial basis, just they want to make the system better. They want to improve the health system out there, and they're struggling to work out how to navigate their ideas through. And so I guess, very quickly before we move to away, and then we can talk about it in greater detail, but how do you snap and create, solve that problem?
I don't know. No. So that's a bit unfair. I think each organization will be slightly different. And you've got to kind of get a feel for how that organization operates so that you can get your products through there. A typical situation is, like, most people will enter the sale thinking, okay, so there'll be a hierarchy. So if I go through here and here and here, they'll say yes at the end. But actually, the way that a lot of NHS organizations are organized is actually it's just a circle that keeps going round and round and round. So you do need, you have to. So I've worked out the two things. One is that just produce objective data. No one can argue, and then there's no hierarchy needed. It's just like this saves you X amount. The other thing that I made a mistake with it was and it's still on the website, but we talk about return on investment. Now, if you're talking in a healthcare context, I don't think return on investment works very well. Now, I don't think it works very well because the way that NHS organizations receive their money is by being able to do more operations, more clinicians being able to do more clinical stuff. That means that they get more money in from the government because they're doing more operations, they're more efficient, and X, Y, Z. So we've changed it from a return on investment to actually you save an X amount of clinical hours, because the people producing the content on CliniBee are senior clinicians. They're like the main guys in ICU, the main people, the main men and women in ICU, and all the lead nurses, all the lead clinicians producing this content when they should be on the front line. And so if you can free up as much of that time and you prove like we've saved 30,000 clinical hours, that means they can redirect it to a more operations or more care or whatever it might be that's not admin. And so we've started talking about that in that language rather than in return on investment. So yeah. Sorry.
So I think that does lead me on to our final innovator, who is Owain, and again another clinician. But actually, in Owain's case, like the level of complexity, if there was ever a level of complexity I saw, it was definitely with Owain's product, because he was solving a two-sided, I mean, you tell us more detail, but you were dealing with both primary care and secondary care, and all of whenever I've looked at problems, that the idea of dealing with either one or the other is like daunting, but dealing with both was just like kind of mind-blowing. So Owain, tell us more about Synapsis and exactly what you're doing and how it affects whole system change rather than like point of care and different smaller solutions, because yours is very much at the kind of macro level.
Yeah, so in its essence, what Synapsis does is it's a communication platform that connects clinicians so that they can make better decisions about referrals, so smarter referrals. But in its essence, it's solving problems for a clinician at the front line. So it means a GP just being able to instantly connect with a specialist, talk about the patient that they're seeing right there, talk about the problem, and come up with a plan together. So it's a very, I think for a digital solution to be successful, it really needs to solve problems for clinicians on the front line. But what we've found is that really by doing that, you can really have a massive impact on the whole system. So by, for example, for COVID, by giving Synapsis to GPs and paramedics and nurses in the community, we reduced the number of attendances through A&E by 30 to 40%, depending on who was sending the patient in. So rather than sending the patient to A&E, they were coming up with an alternative plan. And it's what we found is that you can gain a huge amount of insights from that, and insights that can drive decisions around how services are designed, where money is spent, what transformations are prioritized. And we're doing that now across a number of different services. So elective care, urgent care, adult, pediatric, mental health, so all kinds of different services. But you're absolutely right. It's if I was starting again, probably working at the interface between different parts of the health system, it certainly has challenges for sure.
And Owain, so that I mean, in terms of that how you handle introducing an idea of that complexity, like, you know, the interface point. How are you solving that? So there's obviously the solution you've got, but actually as Alex and Elliot and others have talked about, the actual getting the health service to understand complex solutions to complex problems, that can in itself be a level of difficulty. And anyone that's really interested in digital health and digital health innovation, this is the area where I think most of us end up falling down on, rather than the finding the right solution and finding product market fit and all that. I mean, it's actually just getting clinicians to see it and work with it and use it and champion it and then run with it. It seems to be the kind of the falling down point.
I think it's just that. I think it's remain focused on the end user. So if you add value to a clinician at the front line, and if you help them, you know, help their patients, then and you remain absolutely focused on that, then you will find a way through in the end. And because you will find advocates. So I think one of the things that you need as an entrepreneur is to be able to identify people's strengths. So that's, you know, when you're building a team, when you're finding a co-founder, when you're looking for a partner, but when you're talking to customers and talking to users, you need to be able to identify who's going to be your champion. And, you know, we've been extremely lucky in doing that. So when we, you know, went into our first department to talk about our product, we went, actually, our system was already bought at that point by the CCG, but, you know, we were going in to talk to the acute medics about it. And their view was, you know, at the beginning, well, why would we buy into this? Why, you know, we can see why the GPs would really like synapses, but what is in it for us? And really, we had to think very hard about that and understand actually what is it, what do they want that will make their lives easier? And actually, what we realized that one of the things that clinicians in hospital have lost is control of their work and control of their workflow. So if we started to look at the problem from that perspective, as well as from the community, and we iterated our product, and actually they became our biggest champions. And now they, you know, going around their colleagues, both within their trust and other trusts, you know, talking about what we can do for them. But I'm optimistic about that, actually. I think one of the things I've seen with COVID is that the clinician's voice is become stronger. And actually people are really listening to what makes a difference on the ground. And, you know, that's translating to what technologies are being adopted.
Okay, and so we've had a few questions from. So we've got some students and junior doctors who are all clinicians interested in the innovation space, and they've been asking questions in the background. And one of the things that has been brought up has been how you've all of you have gone about validating some of your ideas. So how have you kind of worked out that this is actually a problem that needs a solution, and then this is the solution for that problem? And I guess that's quite an interesting question, right? Because we all have, I think we've all enjoyed having these wonderful kind of flights of fantasy about how we can change the system, but actually making the system genuinely take on board and make that difference and show that difference is a real difficult thing. So does anyone want to talk about the validation process for their ideas and how they went about doing that?
So I can talk a little bit about it. I think that, again, there's lots of points of view when it comes to validating. So you need to tell the story that resonates with that person. So, you know, I think building products is all about empathy, but getting buy-in is about empathy as well. So, and understanding that, you know, the financial director will have priorities that will be different to that clinician or front line. So you have to understand how your product adds value to all of those people. And, you know, you need to be, I think, flexible and agile, I think, in the way that you describe what your product does, and clear, I think, in the language that you use. But when you're starting from scratch as a clinician, I think if you look around you and think, okay, what's going to add value to me, my colleagues, my patients? And I think that's a really good place to start in healthcare.
Hassan, where I mean, you've listened to all the innovators and what they're doing. I mean, what about you? How do you think the validation process goes as someone that has to look at it from the other side?
So I have to advise companies coming into the UK who ask me how should they sell to the NHS. And I have to first of all tell them that there is no single NHS. There is thousands of organizations. I think the first thing is you've got to be cynical. So even though it's great, you've got this idea, you're passionate, you're idealistic, you've got to put that part of your brain to the side. And now you've got to use your lizard brain. You've got to think, who's the buyer and what's important to them? So if it's about throughput, can you push more patients through a particular part of the service? And by doing so, that's where the hospital is going to be okay, then that's great. If you're trying to save time, release time to care, then that can be deployed in other ways. That's great, but you also sometimes have to make the case for them for how expensive it would have been if they hadn't done that. They would have had to bring in locums. So you have to start thinking very cynically that they are going to say no. You've got to think about the levers you have and who is it that you want to speak to? Is it the CFO more than the CIO? And even though I want to say that focusing on clinicians and how you make it better for them and focusing on patients and how you make it better for them is what you should do, honestly, there's a part of the discussion where you have to think the money man, management, how am I going to make that work? And unfortunately, you have to think with all of those together.
Okay. And Lucy?
Yeah, from my more private and direct-to-consumer experience, I can say that I would recommend to do like pre-validation before the MVP, before the product market fit stage. So for example, starting with a very simple thing like a survey and trying to really start from understanding your audience and who your customer would be, where they are and where you can engage with them, and starting from getting answers from what I often heard as the check payer. So you want to talk, as Hassan said, not to your mom. I would recommend talking to the check payer. So whether it's in the NHS or if it's an actual consumer, talking to the actual audience, the person who has the problem, and if they would pay for the solution, and understanding that a little bit before you then go on to a minimum viable solution, product, whatever, something super basic to try and get it out there and get some understanding from your audience and from obviously a bunch of things that you're going to have to change anyway. So not going directly into like producing something and then checking if the audience is interested, but actually doing that in stages throughout the development journey.
Okay. Elliot?
Yeah, so I just wanted to add that I think it's quite easy to validate a problem because there's so much healthcare research. You can sort of like size and scale a problem and validate it as a problem quite easily. It's working out, is it a problem that anybody actually wants to solve right now, as Hassan's pointing out? So ultimately, everything's going to have a business case. But what I wanted to contribute to this was that some problems are just not best suited to a startup, right? So some problems in healthcare are, you know, Google and Microsoft sized problems, or Epic and Cerner and EMIS sized problems to solve. And you need to understand, you know, can you succeed where others can't? Are you the right team to solve this problem? And I think they're even rarer opportunities as well.
I think you're completely right on that, because often in the conversations I have with clinicians, sometimes we're very good at coming up with very complicated, very complex ideas, and we're absolute. And I have this conversation almost. I think I have it at least once a month with someone who comes up with an extremely complex solution to a problem. But the first question I often ask is, "My God, that is such a complex problem to solve, or a complex solution to put in place. I have absolutely no idea where you even start to try and solve, like to actually make that work." And not from the technical aspect, because I think genuinely you can probably technically solves most things if you spend long enough kind of tinkering around with them. But genuinely, how do you actually introduce this problem into a very complex kind of environment like a health service, let alone this health service?
Yeah, I agree completely. I mean, and it's not just the product. So you have to simplify the solution, but also you have to simplify the entire approach to adopting that solution. I mean, Anas is about, you know, the person to speak to on this as well. I mean, they're executing brilliantly end to end at the moment, and managing the entire journey for the customer. It's a really impressive thing. There's some real change going on.
And I think that leads us nicely into Anas. So Anas, tell us, because actually the way you've structured your company is so insightful about the problems within getting your solution into the health service. So give us some insights into that.
Thank you, Johan. I think, you know, I often tell a lot of my colleagues that employee number one after the founders was our head of implementation. Before we even hired the first coder and the first engineer, we relied on some external development support with contractors before we managed to raise enough to bring everything in-house and build an in-house technical team. But from employee 1 to employee 5, they were all about the implementation, the change management, and the customer success beyond go live. And that came from our experience. Everyone was early on in the business, that often where technology fails is sometimes on the build of the technology solution it is, but more often than not, it's on the execution and the implementation and taking the stakeholder on that journey. And another area that we had to address was that our technology, like many solutions out there in healthcare, have to cover a larger surface area than your consumer products outside of healthcare. Because healthcare does not like single points of value. Healthcare needs large surface areas. That adds complexity to implementation, complexity to stakeholder management, complexity to integration with wider systems used in the organization. And that's where you get your buy-in, if you're getting that right. And one more last point to add is that often we as innovators and entrepreneurs might be, might hit the nail on the head by solving the problem at a certain period of time. But then the world moves on. The solution you built to solve the problems in 2017 might not be the right solution anymore for 2020. It's about ensuring that as you're iterating, not only the first initial attempt at solving the problem needs to find product market fit and be validated, but to continue to iterate and continue to remain relevant for the customer, for the partner, for the end user. As their world evolves, your world needs to evolve with them. So it's how you keep up with that and how you ensure, and obviously we all seen that during COVID, how would you able to adapt with the health economy as it rapidly changes as well with you. And it's all about your relationships, your ongoing relationships with the stakeholders you work with.
I'm gonna come to Alex to tell us to reflect on that, because I think again the complexity of implementation is beyond the business side in the health service. I think just getting any idea through is so hard, and I think it's interesting. It'd be interesting to get your final views on that, and then I'm going to go to Hassan to kind of tell me his reflections on the whole conversation, because we've been incredibly privileged to have all of you here, really. So Alex.
Yeah, just to say, don't be in terms of validating the product. So our product was validated, it was used, people really enjoyed using it, but then we started a wider implementation across 30 different departments, and suddenly the things started to creak, things started to change. So the key there is for us was really not to be too wedded to the design and the architecture of our application. Be prepared to change, be prepared to listen. When someone else validates, or when a larger group or a different organization starts to use your product, they will want to take it in a certain direction. So you got to it's a fine balance between saying no when it's not something that's going to work across the whole platform, but also understanding that what you might have been wedded to and really like in your product, you might need to actually rewrite. So we're rewriting a section of our platform at the moment because we've realized there's a better way of doing something, and understanding that when different stakeholders start to validate and check and use your product, they will take you in, who knows which direction they'll take you in. But you know, the balance is to say no when it's the right time to say no, and to change when it's the right time to change, and no one knows that art.
We've been in the background, as many, for those of you that have signed up through Medics Academy and have access to the resources, you also have access to the virtual coffee space, which several of you are introducing yourselves on and talking to each other on about your ideas, whilst the speakers have been talking more publicly. So keep doing that, keep engaging, because I'm sure there's a lot of very interesting points there about things that they would like to, clinicians would like to see, and how they would like to kind of innovate. Hassan, I'm going to go to you to kind of give us a reflection on the entire conversation, and hopefully make us feel, give us something to aspire to and inspire us to what will happen in the future with digital health. And then I'll do a quick wrap up for this particular session. But Hassan.
Thank you so much, Johan. I loved all the contributions from my fellow panelists. Two things. I think the future belongs to entrepreneurs who are going to say, whether it's clinical or non-clinical teams, who are going to say, we're going to solve something that we believe in. You know, mission-driven, passionate, we'll make this happen. Now, there's lots of challenges, right? Who you're going to sell to, how you're going to find them. Do they even know who you're going to have to meet? Alex has made a very good point there. I think the challenge for anybody is going to be in stages. Get your idea validated, be obsessive about execution, and then make sure that you're close to your customer. I think those three things will get you most of the way. And I think, and I'm seeing lots of students, lots of what we shouldn't be calling junior doctors, but lots of those who are new to the profession, having passion and saying, I want to do this. And I would encourage them to do it. Try not to take risks, you know, spend other people's money or don't spend any money. I think those are the two things you've got to start off with to get your idea validated. But once you do, jump in, because you will find it will improve what you do on all sides of your life. So go for it. Don't be afraid.
Great, thanks, Hassan. This is the first episode of HLA Live, which is, as you can see, a discussion platform, a discussion group that comes as part of the Healthcare Leadership Academy. And the Healthcare Leadership Academy, as many of you will know, is takes and identifies the best young clinicians across the UK and increasingly Europe, and gives them a platform to kind of to make them the best version of themselves. That's how we describe it. Make them the leaders that we know that they're going to become. And as part of that, there are 6 pillars of the Healthcare Leadership Academy, and one of those is how the leader improves themselves as an entrepreneur and innovator. And so today, this has been very much in that for that pillar, to understand where digital health is going. Over the next 2 weeks, we're going to be talking in more depth about entrepreneurship and innovation, how you innovate, and try and give you some ideas and tips about how to grow as a clinician that wants to be an innovator, whether it's intrapreneurship or entrepreneurship. And that's, you know, how do you innovate within the organizations that we see within health systems, and how do you innovate outside of those, and when is the right time to do what? And that's a question that I think a lot of clinicians really struggle with sometimes, because they've grown up in the environment that feels very safe in health, and they don't really want to take that step out. And many of you have heard today from people that have really done some of the most interesting things in British digital health. They're doing things that are really hard to do, which is innovate within the British health system, and they're doing it in a way that is incredibly rewarding, and for both the system and for their teams, who are, you know, some I've met many of the teams of the people here today, and they are incredible people. They're very talented, they're very passionate, and the founders are here, but there's often a huge passionate group of people behind them who are just pushing for the change that they want to see. So join us next week. We'll be talking in more depth about innovation and entrepreneurship, and hopefully you found today useful. You can keep make sure you subscribe to the HLA Live if you're watching this on YouTube. Subscribe to either the YouTube channel, or go onto Medics Academy and subscribe onto the resources. Within the resources, we will put lots of materials from our speakers today, as well as if they've got other things they want to share with you. And we will also share lots of resources generally from across the healthcare leadership community. So thank you very much, and we'll see you again next week.